Dr. John DeMartini. This is one of the most amazing and inspiring shows that you can listen into. If you want to be on the edge of your seats, if you want to open up your heart, if you want to expand your mind, and you want to meet incredible people, stay tuned because you're just about to experience a transformative radio show that will change your life. And you're listening to the Dr. Pat Show that's coming up right next.
Welcome to the Dr. Pat Show. Talk radio to thrive by. Powerful, inspiring, and coming to you live, bringing you stories of people like you and me, busting through and living life full out. Get ready to dare to wonder what your life would be like if you knew you could not fail.
Hey, everybody, I want to welcome you to the show. And by the way, if you have questions throughout the show today, because we've got a phenomenal guest, 1-800-930-2819. That is our toll-free number to call into the show. Today, I want to talk with all of you about what the journey is like and how important it is to meet the right people when you're in a place to heal, when you're in a place to get stronger, when you're in a place to overcome things that bother you. And Mary Jane Mack has been somebody that has been doing this for quite some time, but not because this is just something to do. Her commitment to helping people stems way back, and you'll hear about that. But, you think about what does it take to understand science, holistic medicine, nutrition, the latest that is out there of digital science and healing tools and techniques. Today, Mary Jane is going to walk you through this great way to heal, when you're in a place and you're looking to introduce yourself to another version of yourself, a healthy one, a happy one, then this is where science and healing meet. So you're going to get introduced today, not just to Mary Jane Mack, but to the many tools she uses, and uses them very precisely, very different than throwing a vitamin C pill at anything and everything. Mary Jane, it's great to have you.
Great to be here. It's always fun to be on the show and to share what I do with people. What I do is a little bit different than most people, so it's exciting to tell everyone exactly what I do and how I do it.
I want to go back in time for a minute because I recently have been speaking with a number of healing practitioners, and you all have something interesting in common, but not the same. As far back as you can remember, there was something that you wanted to do in your life. It's something you wanted to do to help people. And then you did. Where does this inspiration come from? Where the beginning? What was the beginning for Mary Jane Mack?
For me, it was basically I worked in labor and delivery. I always wanted to be a nurse. So I worked in labor and delivery for many years. And then when I moved, I was born in Chicago, worked in Chicago, had a great job. We moved to Seattle, and to get a job in labor and delivery, it's a day job, very difficult because once you're in there, you're in there for life. So I worked nights, and after several years of working nights, I just couldn't take it anymore. So there was an opening in surgical recovery room, and my friend said, "Come on, let's go apply." And I thought it was so different than where I was and what I did. So I went down there, but my dad always told me, when you go apply for a job, if they ask if you know how to do something, you always say yes, because they have to train you, no matter what you do. And I had taken a refresher course recently, so I really was familiar with the machines. But I remember my boss said, "Do you know how to work this machine?" And I really did not, but I had total confidence I could. And I said, "Sure, I could." I said, "You just have to walk me through it a little bit." And I knew I could. And I got hired immediately.
Yeah.
So then I was in labor and delivery, and I was the first recovery. I belonged to the first Recovery Room Nurses Association, and I was an officer in that and traveled all over. And after working in recovery room for many years, seeing how sick people were, they never got well, I was ready for a change. So I started getting into more nutrition. I actually had a diet center for several years. And then I knew there was something else, didn't know what it was. And my horses, I had horses, and through my horses, I had issues with my horses, and I started learning more alternative techniques like Linda Tellington Jones and other great people in that field. And then I met a chiropractor who did muscle testing. And I took my horses to this chiropractor and they put them on nutrition. And my horses were better in 3 months than any time before. After getting all the vaccinations and following the worming process and all the things that I thought was right, my horses were in trouble. So after having a 3 month nutrition program for my horses were better than ever. And then they just continued to be that way. And through this chiropractor, I found out about a Dr. Versendahl, who was the genius of this work. And I went to a seminar down in Portland, and there were about 1,000 people in the room. And I remember it very clearly. I sat in the back of the room, third person from the end. And when he was talking, I knew that's what I was going to do. Everything he talked about made total sense.
Yeah.
And so after that, it was a technique of muscle testing. And in that technique of muscle testing, you follow the body, and the body tells you in order exactly the priorities. So I started studying. I got videos and went to seminars and classes almost every weekend. And within 6 months, I started opened my office and was doing, at the time it was called CRA, contact reflex analysis. So then that was the beginning, and within 3 years, I was asked to teach, which was unheard of that anybody would learn it that well. It was my passion, so that's all I did was study
Yeah.
and learn. And then from that was in 92. And then in 95, I hooked up with one of the dentists that taught our work. And he taught dentists he explained it to dentists, and I taught it the next day how to do the technique. So I worked with him for 5 years and also worked for Dr. Versendahl in between. And then in 2000, strictly taught for Dr. Versendahl. And again, it was in 2000 that I realized I was intuitive. Dr. Versendahl would be checking people on the stage, and I could figure out what was wrong with them before he said. And so that was the beginning of learning my gift. And it was pretty amazing. It was like, oh my gosh, this is pretty amazing.
Yeah.
And so from that time, of course, that was in 2000, I've developed my gift much more, fine-tuned it, and I'm very good at what I do. And it's not me, it's a gift from God, but it's checking your body. Your body has all the answers. And I'm just asking your body, what is it?
Yeah. Yeah. But one of the things you said is, and I want to be very clear to everyone today, the term intuitive and medical intuitive now has gone, pretty more mainstream than most people think. And what that simply means is you're able to focus on something specific instead of the whole enchilada. It's like watching my grandmother throw spaghetti on the wall. It's the kind of thing where you have to pinpoint what has to be done first. Now, today, what you're going to hear is this is the journey, but then there's a creative part. Then you take everything you are, like Mary Jane Mack did, and you put it all together and you create the state of the art, just right state of the art way to heal. When we come back from break, this is where healing meets science. This is an introduction to Wellness Pro, Stimpod, and many, many other things. I hope she's going to talk about the lights. That's the most fascinating thing to actually watch. But it's not all the technology. It's what Mary Jane Mack does. She will not put something on you, do something with you, if it's not the right thing to do to take care of your number one priority. We're going to take a short break, Benny and Emily. And when we come back, how do we get from this absolutely beautifully respected life and career to being one of the leaders out there on the edge all the time, understanding what things are out there to heal us from very, very many things. Stay tuned. We'll be right back. Hey, everybody, welcome back to the Dr. Pat Show. This is Talk Radio to Thrive By, and we are live. So you get to call us in, ask questions. If you got something aching on you, whatever that is, Mary Jane is going to be able to take a look at it and give you some recommendations. 1-800-930-2819. That's the number. Benny, what's the local number? Your 425 number.
Sure, it'll be 425-373-5527. 425-373-5527.
Don't you love that voice? Mary Jane just gave you a snapshot of where she was and where she almost is today, but you're going to hear more. There is a level that most of us come to where something happens in our bodies. For me, it was what everybody called a mystery disease, and the mystery disease was not helping me get better by traditional methods. And so I didn't study what Mary Jane studied, but I sought out people that could give me something other than bad news every time you go see them. You have to have some ways to figure out what's going on. And the pain, I can't even describe to you the pain. And I pretty much kept it under wraps for all of you that have been listening to the show. You didn't see me complain about it. I didn't talk about it very much. But I can tell you, every time I came into the studio with Benny, I cringed just, and he would watch me getting up and down those big chairs. That was like climbing. I might as well have been climbing Mount Rainier right there. But today we're going to take a look at the breakthroughs in the industry, what I discovered, what things actually kept me alive outside of everybody else giving up. But before we do, Mary Jane Mack is my very special guest. You heard me talk a little bit about her. Please go to maryjanemack.com. Everything is there, and then some. Schedule time for her, give the office a call, whatever that is for you. Mary Jane, what's the phone number in the office there for people to call?
It's 425-777-4232.
Now, let's fast forward because, you and I discovered a lot with chiropractor and a lot with, with other ways of healing. I don't use the term alternative anymore. It just doesn't make sense. But we're finding ways that are so ancient, so old. Don't you ever wonder how we exist as humanity, how we did that without medicine? Why didn't our species get completely wiped out? Because we discovered some things on the way. Fast forward to where you are today, and how have you kept on the edge, the leading edge of technology and science here in healing?
Well, for one thing, I taught the work I do for over 15 years. And during that time, went to every seminar I could possibly go to. And since that time, I've attended every seminar that I could learn more technology to help other people. I belonged to the Master Circle, which was an organization for chiropractors. I was the only non-chiropractic member. But the seminars were so great with learning the latest technology and what really benefited people and made a difference. And so it's through that constant education that's made me who I am today. Because if I wasn't persistent in doing that, I would never know, be able to keep up with things. And how would I be able to, because I do that, I can share things with people they would never learn about if they didn't hear it from me. Because there are people that use the technology, but there's not very many. It's all very recent. The Wellness Pro has been around for a while, but other technologies are pretty like in the past 4 or 5 years. So it's always changing, always updating, always getting better, making a difference in people's lives. So it's easier for them to find where they're going and how to get there.
Yeah, and this is the roadmap that I want to talk with you about, and the introduction of technology, because you're already, all amazing at being able to pinpoint what's going on with somebody. But our limitation in medicine, correct me if I'm wrong, has always been to heal, not symptom removal, but to heal. And I'm not kidding. If you go back in time, like you can go way back, you'll see that healing was the objective. Yes, take care of symptoms, take care of pain. And so, talk about the technology that you added. What was one of the first big things you added to your practice?
Oh, my light technology, that was years ago. That was way back in 2000 or late 90s. Dr. Versendahl developed the light technology, and now it's very popular. But at that time, we used these specific lights, and we would have people come into the office and just put all these lights on their body. And what it did was the energy from the lights increased the cell production and raised the body vibration so the body could heal. Because people would be so tired. And I muscle test so I can tell exactly where you are and where you are when we're done. But say you should be a score of a 10, people would come in a 2, drag themselves in there. I could put them on those and depressed, really depressed. I could put them on those lights for an hour, sometimes 2, and pull them out of the worst depression. And sometimes they were suicidal. But those lights raised the vibration so high, the frequency, it's all about frequency and vibration, that they could start to think again. They had a different attitude. They felt better. Even after one session, I would always repeat that, but that made a difference. And in teenagers too, had teenagers who were in trouble. But the light it's all about raising the body's frequency. And when you raise the body's frequency, the body can heal.
I want to ask you this. Along the way, you've seen some things. I'm just saying. You gave us a little tidbit on the horses. But you've worked with other people's horses. You worked on numerous patients that come to you. Give me your top experience with watching somebody literally transform from I can't move to now I'm alive and well.
Well, there's so many stories. There's so many stories, but it's like it's all about the body vibration, understanding where the body is to start with, and then listening to the body for what that path is to get them well, whether it be the lights, nutrition. We use other technology, the Resumex, Wellness Pro now. But going back, we use mostly just the lights and vibrational tools, tuning fork to help them. I do cranial work, so I'm able to see where their cranial bones are. I do cranial release technique, which balances all the cranial bones and gets them back in rhythm. So somebody could come in just dragging, not feeling good, be totally disconnected, and just doing a few things like the cranial release, connecting their body, figuring out where they are, and everything would make sense to them. Because many people I saw came in, they had been to every doctor and no answer. And then there's the people that came in with who had diagnosed with breast cancer and already saw the surgeon. Surgeon wanted to do surgery and do a mastectomy right away, and asked what I could do. And I said, well, this is what I would recommend for you, and this is your decision, but it's a nutrition program, but you have to be on it at least 4 weeks, then go back to your doctor. And because it takes time for the body to heal. And but it was their choice to not do the surgery immediately. But of course, I always refer them back for their referral. And when she went back to the doctor, she did not have anything. They did not do the surgery. She's still a client, and she's been a client for over 15 years. So, and then I had another gentleman come in, and he was a referral, didn't know me. He went to the doctor, he had a liver biopsy. They wanted to do surgery on him, and he asked me what, he heard about me and said I did magic, is what he said. What could I do? Well, actually, he had a bad gallbladder and bile duct and a lot of stones in there. So again, I told him he was supposed to go back in a week and have this surgery. And I said, it's not a quick fix. It takes 4 to 6 weeks to get everything back to where it should be. And at the time, we didn't have all the technology we have today. So he decided to do the program. He went back to the doctor, and the doctor said, they asked him, well, what did you do? All his tests were normal, nothing abnormal. And they wanted to know what he did and how he got there. And so those are just a couple of
Yeah.
simple stories.
Yeah.
Horses, we help them pull them out of colic. You know, I can give recommendations what they need to do. But there's always an answer. It doesn't matter what you have, there's always an answer. And if there's somebody that I can't help, I never accept any clients that if I can't help them, I would say you need to go to someone else. That it would be a rare situation, but
Yeah.
I never accept people that I cannot help.
Yeah. No kidding. Both of us have learned that lesson, right? I mean, I
Yeah.
go through that with, people wanting to host a show, and 99.9% of the people are ready. The smallest percentage really want to be ready, and they're just not quite there. But we do help them get there like you do. I want you to describe something, because I think this is where people get confused, and I didn't understand it either. When we talk about nutrition, I want to be very clear with people. This is not going to your local grocery store, your local pharmacy, and going down the supplement aisle and picking things out. That is, I've learned that is one of the worst things that I did to really get myself pointed in the wrong direction. So, mystery disease plus really bad supplements, there you go. But let's talk about you and what you use. When we talk about nutrition, we're pinpointing very specific answers to a very specific problem. If it's a gallbladder, there's something for that. If it's stress, if it's whatever it is, stomach, there's something specific, but you have to know what to put in your body. So tell us about the nutrition you use and the quality.
Yeah, I use Biotics Research Nutrition, which is the absolute top of the line. There are no products better than Biotics. Their ratings and quality control are absolutely the best. Often you've heard about the government wanting to shut down vitamin houses and supplement places. Every now and then that comes up. They could never shut down Biotics because they're the purity of their product. When they get their products in, they're all tested, and if they don't meet their quality, they move them on to they're moved on, and other supplement companies pick them up. By the time they get to a vitamin house, you have just nothing. There's nothing in there. There's no two pills in there alike. And when it says like 300 milligrams, you don't get 300 milligrams because it's not a pure product. Where Biotics products, why I have such great results, every pill in the bottle is almost identical. So when I recommend you take 6 of these or 3 of these, I know we have predictable results. In a certain time, you're going to be better. And if you're not better, you're doing something wrong, or your digestion needs a little more help. So it's like a given. But Biotics is absolutely the best. And when people are trying to do their best, they go to the health food store and they're kind of using the shotgun approach. They think, well, I'll take this and I'll take that. That says this is good for this. I have people come in with bags of supplements and not one of them tests good. I'll test them for them. None of them test good. So I save people a lot of money actually by giving them exactly what they need. And I have something for everything, whether it's the flu, colds. It doesn't matter what it is. When you're a client of ours, you call our
Yeah.
office, we take care of our people. Yeah.
Well, I have shared this story, and I'm going to share it one more time. When I first met Mary Jane Mack, and for those of you out there, you just go to maryjanemack.com, or I highly encourage you to call the office. Even if you're not sure what to ask, you'll get a consult with Mary Jane and you'll see what it's like. But the most important thing to do is to think about where you want to go with your life and how you want to get there. And if what you're doing is not working, then this is where you give Mary Jane a call. It's 888-777-4232 to contact her directly. And it's info@maryjanemack.com. For those of you that don't like the phone, there you go.
Let me tell you the number again.
Okay.
It's 425-777-4232.
There you go. 425-777-4232.
Yeah.
And what this is for you is to have a conversation. I want to talk about a couple of things very specific. And one of the things that I'd like to talk about is there are two devices that I use, or when I come, I get to use them. We've touched upon light therapy, but I think the most important thing for people to hear more about is really to understand what, well, the Wellness Pro Plus, what that machine device does. And that for me, for those of you out there, I see Mary Jane on a regular basis. But the thing that I want you to know is the miracles we have seen, because Mary Jane could pinpoint something, especially for Linda's mom, who her heart was around a 30 functioning. And Mary Jane saw that right away, recommended nutrition for it. And within 30 days, back to the doctor, her heart performance went from something like 30 to 60. And everybody scratched their head except Mary Jane. Now, let's talk about a device that is so precise. It will get into what is exactly happening in the layers that you want it to. Talk about the Wellness Pro.
The Wellness Pro Plus is a frequency machine. And what that means is the machine actually has over 2,000 frequencies coded into it for every condition you can imagine. And when you have a certain condition, say you have, gallbladder issues or stones, the cells in that organ are not working properly, so now they cause dysfunction. They might cause pain, might cause irritation. They're causing you to not feel good. The Wellness Pro, well, when I can identify exactly what the issue is by doing the muscle testing, and so now we know exactly what we're working with, then we use the Wellness Pro, and you sit in a chair and you either hold cylinders or we put pads depending on where you need them. And then we set the machine to the code that is specific for you, whether it's be a gallbladder, whether it's pain and inflammation, whether it's arterial sclerosis, diabetes. It doesn't matter what you have, because this machine has everything in it. So when people come in, it depends on what's going on with them. Like sometimes if they just have an injury, it might be one treatment. If they've had a chronic injury, it could be 2 treatments, say for 6 weeks maybe. And that treatment could be a half hour to an hour. And we just program the machine, you sit there and relax and enjoy it. And now that frequency is actually going to that specific part of the body, healing the cells. Because without that frequency, the cells can't heal. It takes longer. That's the deal. It takes much longer. Yeah. So the Wellness Pro, we see incredible results in a short time. And that could even be for broken bones. It could be for trauma, like you had a scar or an injured arm, could be skin cancer. It could be anything. And I'm not saying we heal skin cancer. I'm saying we could treat where you're at to help you with your treatment, with what you're doing, your doctor. So everything we do is to assist you, no matter where you're at and what you're doing, to be better. It's really fun, the frequency machine. Yeah. It's for injuries, for chronic bladder irritations, incontinence, and all these things. It's just amazing results.
Yeah, I read there are over 1 million different frequencies in the wellness in the Pro machine, but it does some other things. For those of you out there, what it does, it really does, this is layperson term. These impulses, these magnetic impulses, these frequencies literally stop pain. And that go to, they
Yeah.
block it. They block the pain signals, I think it is. But the other thing that it does is it also can stimulate endorphin production. Can you talk to that for a minute?
Well, when you get rid of the pain, like that's one of the big things Wellness Pro does is for any kind of pain. And often it's one treatment. You can either get rid of or reduce it significantly. And so when you reduce the pain and you increase the body's energy to the brain, the body will produce endorphins, which then protect the body and make you feel good, make you happy. And it's all about taking care of the major issue that can change everything.
Now,
I love the Wellness Pro. The Wellness Pro is just again, when I can muscle test, I could pinpoint exactly what it is. If somebody comes in and tells me they have pain in a certain area, we could just put it on that area. We know we're going to have results. And most of the treatments, they can be anywhere from 20 to 40 minutes, some an hour, but most 20 to 40 minutes.
now we're going to take a short break. When we come back, we're going to do a deeper dive into how do you know where to start? How do you put together what the plan is? Because this is what you don't get when you go to a grocery store and you're handpicking things. You just don't know what you're doing. But what if you could work with someone that could say to you, we're going to take things one layer, one step at a time. And they start you out with something that will help, for example, your kidney. See, it's all connected, but a lot of times we get everything thrown at everything, and it doesn't really get to pinpoint a solution. The other problem that I ran into with that approach is not only that, you're throwing everything at everything and you're creating a level of toxicity. We're going to take a short break. When we come back, we're going to talk more about this, but there's another device that I want you to hear about. Stay tuned, everyone. We'll be right back. Hey, everybody, welcome back. I am so thrilled to have Mary Jane Mack here. As I said before, you can find out more about Mary Jane by going to maryjanemack.com. The other thing you could do is call at 425-777-4232, 425-777-4232, and just schedule time to chat. Most of the time what we do, Mary Jane, is we think, I have been to everybody. Nobody can really help me. At least that's where I was. And yet at the same time, you meet people and you start to think, well, can they help? Maybe there's something I haven't done. And, where you are today, not only have you learned and continue to learn, but you're also adding more and more things. Let's talk about, if we could, another device you use, and that is the Stimpod. And that is fascinating to me because it's a bit different, but its effectiveness.
Yeah, actually, you can compare it to a TENS unit. The Stimpod is a TENS unit on steroids. That's the difference. I mean, it's when you look it up, a lot of it is when you use the Stimpod, what it is a radio frequency that you identify where the pain or the nerve that's causing the issue is, basically working on your nerves. You identify the nerve, and the little device tells you when you're on the nerve, and then you ask the client, they can identify if you're in the right spot or not because it tracks down the nerve. So say they're having pain in their sciatica. We actually can treat that following the sciatica down to the ankle. So you treat that nerve in the ankle and you only treat it for 5 minutes. The idea, it sends in a radio frequency which disrupts the nerve. So the nerve, it stops the pain immediately. Now the nerve can heal. And depending on the person, sometimes one treatment will last. I mean, sometimes they're better after one treatment. Other people might need several treatments, but it works every time as long as you identify and you hit the right nerve. I'll give you an example. I have my neighbor, 91 years old, was treated for cancer and she had sciatic pain. So her son-in-law came over and said, "Oh, she's so cranky and she's not happy. Do you think you could help her?" And she was not open to alternative or anything, other options before. So I went over there and I took my Wellness Pro and I took the Stimpod. So I worked on her, and when she stood up each time, this was like I worked on her Thursday, Friday, Saturday, no, Thursday, Friday, and then not till the following Monday, three, maybe four times.
Yeah.
And every time she stood up, she said, "Oh, I'm great. I don't feel any pain. I'm out of pain." And then she said, "Oh, it's back. It's back." So no matter what I did, that was her answer. So, but by the third time I worked on her, I noticed she sat in the chair, she picked up her leg, put her shoes on, she walked from her place to this house, was like 100 steps, forgot her cane. So it was all these things that she could do that I said, that's kind of interesting because before she couldn't do any of that. And then I said, okay, well, and I just kind of left her and then went back on Monday. And the son-in-law said, it's a miracle. She said, she is like totally better. She's still not sure if she's better, but she's doing everything. She's not having any restrictions. So
Yeah.
the Stimpod, what it does, it gets people out of pain, but it allows the body to heal. And it doesn't matter what it is, whether it's a TMJ, cranial problem, like Bell's palsy, that's the worst pain you could have. Again, it could be you had a broken bone, you had an injury, you pulled a muscle, any type of injury, any type of condition where you're in pain so the body can't heal, you can identify that nerve very quickly. It's like a 5-minute treatment. It's very quick and have great results. Yeah. And you know right away. It's not something, same with the Wellness Pro. Sometimes you need more treatments to have with the Wellness Pro to really notice total improvement. But sometimes it's only one. But the Stimpod, usually it's right away. Yeah. And what it does, it calms down the vagus nerve. When you calm down the vagus, everything is about your nervous system and your brain. The vagus nerve, when that's in overdrive, you're in sympathetic overdrive. That means you're in fight and flight. You're just always, your body's always trying to catch up. What the Stimpod does is calm down the vagus nerve, then the parasympathetic, the good energy can come in and heal the body. So we're always looking for that balance. And with the muscle testing I do, it's very specific. So I can cut to the chase and help people figure it out and go right to the problem. And it's just fun. Everything's about vibration. It's just fun. Yeah.
It is. And one of the things that I've said to you, and sometimes we can't find words, but one of the things was I feel lighter, right?
Yeah.
Now, I didn't go in there and lose 20 pounds, but I may have lost 20 pounds of junk or something that my body doesn't need.
Well, stress, your body is under stress. And it's like when your body, that's the deal, is stress is the killer today. So when you're in pain or uncomfortable, your body, think about your body underneath. The people say, "Oh, I'm not stressed." Yeah, well, let's look at this a little different and ask some questions. And yeah, they're major stress, but they get so used to it, they don't think of it that way.
Yeah. And so we've got a couple of minutes left. I want to talk with you a little bit about where you are today and where you see this going. We touched upon the light therapy, out of all of the things we've talked about, that seems to be like bursting through. The other technology we also talked about is becoming more householdish. There are people that understand this now more than they ever have. What do you see as the greatest challenges to people really getting well? What do you think the challenges are from where you've seen and sit?
Well, most people don't realize that they're not well. That's the first thing. You ask people, "Well, how are you?" "Well, I'm great. I feel good." And then you ask them a few more questions. "Do you have this?" "Yes." "Do you have that?" "Yes." So it's people recognizing where they're at, and it took them a long time to get that way. And when they come to see me, I don't do a quick fix. I mean, you're better, but it's a journey. Like I can get people out of pain very quickly or out of discomfort very quickly. That's just the beginning of their healing. Then there's a process to continue that so they get to their ultimate goal of being the best they can be. If people come to me and they just want that fixed, you might say, that doesn't work because they're going to come back in another couple of weeks or month. It never works. It's the people, I have clients of mine that have been clients since the beginning. And so, you just call at a regular time. Sometimes people call every 3 months, but I'm always there. But the idea is those people stay stable and keep getting better. We catch things before it's an issue, and they have to start and go like 6 weeks to get better instead of 3 days to get better. So the big thing is the awareness for people to know that stress is the biggest killer today and cause of illness, and that it's a process, but there are definitely tools to increase their vibration and make them better and being the best they can be. And with the technology I have, we can do that in a short time versus 6 weeks. Like say getting a gallbladder better, that's 6 weeks on just nutrition. But we have a Resimex tool, we have our other tools, the lights. When you use that technology, you get better in days.
Yeah. And the Resimex, it's a small device that packs a punch.
It's just incredible. And what I do is I stack all these things in my office. It's called neurostacking. I work with a lot of great neurologists around the country. So when you use like the Resimex, then you add Brain Tap. We also use Brain Tap. You could put that on too, and then you're using the Wellness Pro. You do it all at one time, you have great results. It's like that's neurostacking. That's building the brain, making the brain active, and waking the brain up.
Yeah. And part of this too, of what you're doing, correct me if I'm wrong, is you also have a process to detox somebody. Sometimes they have to detox before you can put anything else in there, right?
Right.
That's
And
something you look
often
at.
that's often, to be honest, that's usually a gallbladder and a bile duct issue. And when you work, they can't go anywhere till we take care of that. When you have a bile duct and a gallbladder, a 2, say, out of a 10, everything in your body is a 2. Everything. So you're tired, you're sluggish, you're hurt, every bone in your body aches, and you all of a sudden you don't know how you got like that.
Yeah.
When you clear the bile duct and gallbladder and get it detoxed and healed, everything else gets better at the same time. Then you fine tune what you need. But some people, if you go to somebody in that condition, they might use the shotgun approach, give you all kinds of things, and then they're taking care of you out of order and you don't get well.
Yeah. Mary Jane, thank you for today. Now, I want to just be clear. People can call your office, even if they don't know what they don't know. They can ask you questions about the things we've talked
talk
about.
To Nancy. Have them talk to Nancy.
Yeah.
Because Nancy is a wealth of information and she could help them, and you can ask her questions and she'll take care of you.
All right. One last time. Website information, maryjanemack.com. And that number for them to call is 425-777-4232.
Yeah, and it's info@maryjanemack.com is the email.
Now, last thing. What's your personal message? What do you want to leave people with today?
Personal message is enjoy life. Experience gratitude every day for all you have. And if you don't know what you have, start looking for the little things. And that's what matters. When you have gratitude, your life will be filled with abundance and joy, and you will have everything you need to be the best you could be.
I love it. Thank you so much, Mary Jane. Thank you, Benny. Thank you, Emily. And thank you to all of you out there. You're the best audience on the planet. We'll see you next time.